Medical marijuana in Ohio. In November of 2015, voters overwhelmingly defeated the Issue 3 campaign. Still, there is plenty of public opinion out there about medical marijuana. State Senator Dave Burke recently held a series of medical marijuana town halls across the state of Ohio and serves as the point person for the Ohio Senate on this issue. He is a registered pharmacist. Join us now for an in-depth look at medical marijuana, the current bill that the legislature is reviewing, with State Senator Dave Burke. Let's start with the medical marijuana town halls. Why did you think that was important to do, and what did you learn from it?
Well, Issue 3 was kind of a surprise to a lot of us in the General Assembly. They got the signatures, they put it on the November ballot, and it failed. It failed because of the monopoly provision. Yet there was a constituent-driven initiative to medical marijuana. It ended up on the doorsteps of your Ohio House. It was up to us to respond. The course of action could have been do nothing, but we didn't want to take that approach. We wanted to go out and listen to our friends and neighbors and understand what they meant. So we went to the four corners of our state directly, Senator Yuko and myself. The House stayed here in Columbus, and we wanted to get a definition of what people meant when they said medical. I think we've achieved that in this bill.
Do you think there was enough support from what you heard around the state for a true medical form of medical marijuana as a law here in Ohio?
You know, I heard two things, John. I heard medical marijuana, so defining that term, which to me was a more prescriptive type process, like you think of any medical procedure. The second was, if you have to do this, I'd rather it occur in the law than a constitutional amendment. Time and time again, we heard those things over and over again. It was a call to action.
Was there enough support there for you to believe that people were supportive of medical marijuana, not recreational marijuana?
You know, John, after you hear these stories kind of back to back and you start to piece together in different places across the state what people mean, that message becomes clear. I saw people that I would consider to be a textbook case, looking at it through the eye of what do my constituents mean when they say medical, and then what's maybe in that kind of gray area, and then what don't they mean. So I saw that spectrum we were at across the state, and it helped me craft policy directed to what people meant when they said medical.
You're a pharmacist by trade.
I am.
Define then medical marijuana. What is the definition of that?
Good question, and I would say that there are three categories of this definitional thing that people talk about. The first is medical, the second is medicinal, and the third would be herbal. When we talk about medical, we think about prescription drugs and the way things are handled today, a regulatory scheme, right? Some fact behind how these decisions are made, overseen in a way that protects people and gives a consistent product all the way, and probably more importantly than anything, does not cause harm. That's what healthcare is really all about. And that's what the oath is about, right? Don't cause harm. It says you don't have to help anyone. It just says don't hurt them. So when I hear people say that folks should have access to this, I get that. But on the other side of the coin, I also heard people say, but I don't want children to have access to this. It shouldn't be a drug of abuse. I don't support smoking. You don't grow medicine in your backyard. So as easy as it was to define what people wanted, it was also easy to define what people didn't want at the end of the day.
For years now, we've heard the FDA say smoking is bad. It's dangerous. It causes cancer. Yet, for the people that initially, through the Issue 3 campaign, had been talking about medical marijuana, but really many people saw that as a disguise for smoking recreational marijuana. What is it about smoking that it seems like many supporters would like the smoking part of medical marijuana? And is there a better delivery system when the FDA says smoking causes cancer?
Well, again, when we look back at our textbook cases, the folks I thought were clear and by far definition a medical need, they weren't smoking marijuana. These are people who were children with seizures. Children aren't smoking marijuana. People in hospice or other kinds of conditions where they're simply not able to smoke, even if they wanted to smoke. The textbook cases, they weren't about smoking. Even people in chronic pain, they would talk about rubbing oil on a certain part of their skin or another mechanism of ingestion other than smoking. So we started to understand that the true definition really wasn't around smoking when it came from the patient's point of view. But secondarily, there is not a single prescription drug that you smoke. Smoking just is not a viable method for drug delivery. Now, in the bill, you'll look and see we talk about vaping. Vaping isn't a combustion type product. It is a heated product where the oils from that product are released and inhaled, similar to a nebulizer treatment that a child with asthma may take. And those mechanisms are completely different, believe me. One is a fungible type of product, meaning raw marijuana, and the problem there is I can't tell the Ohio marijuana from the El Chapo Mexican marijuana, versus a product that's actually refined and defined in its strength, that is an oil or other type product that comes to you in a known dosage form. So I go back to public safety. You would want what your child is getting to be of a known amount in a known product. We can do that in the state of Ohio. Homegrown marijuana, Mexican cartel marijuana, you don't even know what's in this stuff. I mean, we can't even get clean heroin anymore, John. It has fentanyl in it. So how are we supposed to control a market that's controlled by people who just want to make money in a cartel type setting that is unregulated? That's unsafe.
And that's what you get with smoking.
That's what you get with smoking marijuana.
But again, this plan, no smoking of marijuana, but the vaporization delivery or the vaping delivery.
We do allow for vaping, and we put a safeguard around that because we've asked the boards to look at regulating devices as well. So refilling your nicotine pen with this oil probably isn't going to be the deal. Looking at a mechanism that maybe delivers the drug in a correct way, in a known concentration, the way your doctor intended, that's a reasonable approach.
How do we track this? I know the bill that we received from the House talked about a medical marijuana control group or board, a commission in other words. Where do you think that the oversight and tracking of this product should be? Should it be within a different state agency? Should we be creating another bureaucracy? What do you see?
One of the pillars that we had when we went down this avenue was that we weren't going to create another branch of government, another taxing entity, or use regular tax dollars to fund this activity. So where does it already exist? And it exists in the State Board of Pharmacy. A lot of folks don't realize here in Ohio, we have companies that manufacture drugs. We have people that distribute drugs called wholesalers, and we have people that sell drugs called pharmacies. They're all licensed, they're all inspected, they all keep records. When I heard medical, I expect people would want a system that runs parallel to the current system. If the FDA or the federal government decides to change their regulations, we've already got a scheme in place, and it's a simple shifting of gears over to an existing system. So why recreate the wheel when you already have the infrastructure?
So run it through the State Board of Pharmacy.
We would run it through the State Board of Pharmacy. And the medical board as well, I might add, because again, all the professional oversight that you see today with any prescription drug, that continuity of care, right? Taking care of the person, not just about marijuana, I go back. The patients we saw were complicated disease states, cancer, seizures. These are complicated disease states. Making sure that patient and the physician have a working relationship is also something you see in prescription drugs.
You brought up a little bit earlier about children with seizures, and obviously there might be some patients who would use medical marijuana, the active ingredient in it, an oil, an edible. Are edibles part of this, and how do you make sure that children are not at risk of being poisoned by eating something that looks like a gummy bear or eating something that looks like a candy?
Well, we're not doing candies, we're not doing gummy bears, we're not doing brownies or cookies. When we talk about edibles or infused products, we leave it up to the state board to do several things, and the State Board of Pharmacy, that is, to have a product that is not appealing to children, that it is in a child-resistant package or container. So we won't be doing red cherry gummy bears. We're not going to be doing brownies. We're not going to be doing cookies. The problems with those other products are they're not consistent and the dose is undefined. They're hard to make in a uniform way. Now, a lozenge for someone with cancer that's unable to eat in their final days of life, that makes sense to me. So those are the type of products that we're looking for that are convenient for the patient, but yet don't cause harm to the public.
Would you agree that when we talk about medical marijuana, that this absolutely has to be focused on the medicine and not about the money?
Absolutely. There's a bifurcation that's happening here. When I heard my friends and neighbors, whether they're old or young, talk about medical, I believe they were talking about doctors and patients and prescription drugs. I don't believe they were talking about cartels, growing marijuana, or smoking marijuana. But I believe the General Assembly has sat up and listened to their friends and neighbors and directly addressed the issue that was brought to our attention in November, and I believe we've answered it in a safe way.
What is the alternative? Because the Issue 3 campaign, $20 million plus spent on that campaign. Not every lawmaker in the Ohio legislature supports marijuana in any form whatsoever. What is the option between this piece of legislation and really having it drill down on medical, not the money, but the delivery and getting it to the people who need it the most, versus the alternative of this going into the Constitution?
Well, you can't change the Constitution, John, and I think the last thing we took out was probably alcohol prohibition. Even the folks that would like to see this business flourish, who are bringing this ballot initiative forward, admit they've made mistakes in other states. The problem is you can't fix it once it's in the Ohio Constitution. The law, however, is something we can change. So I can get as close to perfect, and I can chase perfect every time we meet in the General Assembly. I can do that. You can't do that in a ballot initiative. So if you think the ballot initiative is perfect, I have yet to see a perfect piece of legislation, by the way, that is a fatal flaw. That is one that is not correctable. Legislation, John, I can go back and fix that. If I forgot something, if something needs change tomorrow or 10 years from now, I can go back and adjust. You can't do that in a constitutional amendment.
State Senator Dave Burke, thanks so much for your time.
Thank you.
And for the very latest on the medical marijuana issue legislatively in the state of Ohio, make sure you subscribe to our social media channels. That's at Ohio Senate GOP. On the web, it's ohiosenate.gov/Republicans. I'm John Fortney from the Ohio Senate.